Hello everybody and welcome to the Thursday edition of Video Clips. Functional medicine is a form of alternative medicine which was launched in 1991 by nutritionist Jeffrey Bland and his wife Susan. And the reason I'm talking about it today is that we have a lot of people emailing us and many people joining Wellness Forum who have been patronizing functional medicine doctors and very confused about some of the things that they do. And so I decided to look into what they do. I have my own opinions about it, but that doesn't really count so much. I decided to look into what they do and report on what I found out about the practice, where it came from, and whether or not it's effective. Well, according to the organization's website, functional medicine addresses the underlying causes of disease and involves a partnership between the practitioner and the patient. Well, so far, this sounds pretty good. Practitioners spend time with their patients, taking detailed histories and performing extensive testing, which followers say is due to the biochemic individuality of each person. So it's necessary to do all this testing to find out a lot about the person. Genetic and environmental factors are taken into consideration in order to support, quote, the unique expression of health and vitality for each individual. As with many questionable health practices, functional medicine features some of the right ideas, such as questioning the traditional medical model, acknowledging the connection between diet and health, and focusing on the whole person. The fact that practitioners spend extensive amounts of time with patients is appealing because often people feel sort of depressed in traditional medical offices where doctors don't spend much time with them at all. The problem is that the time is spent administering unproven tests and prescribing so-called treatments, many of which are not evidence-based and in many cases are actually for made-up fictitious conditions. Functional medicine doctors are very liberal prescribers of dietary supplements to treat symptoms, and we here label them as the real holistic pharmacists of medicine. Jeffrey Bland, the founder, has an interesting history, much of which involves selling dietary supplements about which he's made exaggerated claims. In 1995, the U.S. Federal Trade Commission levied a $45,000 civil penalty against Bland and one of his companies, HealthCom. The FTC action was in response to Bland's violation of a 1992 order regarding deceptive health claims for supplements marketed by his company. Bland had claimed that Ultra Maintain and Ultra Meal, two of the supplements he sold, altered the mitochondria in the cells in order to convert more food into energy, and made unsubstantiated claims regarding the products that he sold, including weight loss, disease symptom reduction, toxin elimination, blood pressure, and blood cholesterol. The Institute for Functional Medicine is currently chaired by Mark Hyman, a medical doctor housed at the Cleveland Clinic. Unfortunately, this arrangement has given both Dr. Hyman and functional medicine some undeserved respectability. Why has an institution like Cleveland Clinic taken in Hyman? Well, the Cleveland Clinic features many great doctors like Caldwell Esselstyn, but the clinic is like every other large medical institution in the United States. Most of the medicine practiced there is not evidence-based, so Hyman fits right in. Chairman Hyman's ideas about health are interesting, if not evidence-based. He's the author of several books, including one called Blood Sugar Solution 10-Day Detox Diet. A website promoting the book includes a quiz which allows people to determine if they need his detox blood sugar control program, and the questions include, do you crave sugar and carbs? Do you have belly fat? Do you have trouble losing weight? Do you have FLC syndrome, which refers to feel like crap? And this syndrome includes symptoms like fatigue, brain fog, digestive issues, mood problems, allergies, joint pain, skin problems, and autoimmune disease. Like many online diagnostic quizzes, it's designed to show that almost everybody needs Hyman's solutions. So, if you answered yes to the right questions, what would Hyman propose? Well, one of the many products featured on his online store is a 10-day detox kit that sells for $144, and the kit includes multivitamins and minerals, Macular Synergy Complex, which is vitamins for the eye, Metabolic Glycoplex, which is a unique combination of alpha-lipoic acid, cinnamon, and L-carnosine, which provides critical antioxidants and phytonutrients that improve insulin sensitivity, scavenge free radicals, and support healthy blood sugar levels. Metabolic Lipidplex, alpha-lipoic acid with glucophenol, omega-3 fats, magnesium, taurine. I mean, it's a very big list of isolated nutrients. No references are provided for the use of these supplements for detoxification or blood sugar control or anything else for that matter. It seems that Hyman is carrying on Bland's tradition of just making stuff up. The website claims that, quote, the unique combination of supplements in this kit is designed to provide a foundation for cellular sensitivity to insulin as well as to sustain the metabolism of fats and sugars. These supplements should be taken every day for the rest of your life for maximum effect. Well, taking these every day for the rest of your life would cost $1,680 per year. Windfall for Hyman, who sells these products with no proof that they improve the health of consumers. Hyman sells many other products which he also says should be taken for the rest of your life, like thyroid support and essentials for men. An average family of 4 would need to commit a significant portion of household income just to pay for Hyman's many supplement regimes. Functional medicine doctors usually begin with an extensive series of tests. At the Cleveland Clinic, I believe the tab is $6,000, which is not paid for by insurance, tests before you see a doc. These tests include hair analysis and a metabolic profile, as well as testing for parasites, fungus, celiac disease, hormone levels, adrenal stress, food allergies, micronutrient status, GI function, heavy metal toxicity, neurotransmitters involved in mood and cognitive function, organic acids, and Lyme disease. These tests are supposed to provide valuable information about why people are experiencing conditions like weight gain, depression, and poor health. You know, it is really a mystery why people gain weight, isn't it? We have to spend a lot of time figuring that out through testing. The problem is there's little evidence to support the use of most of these tests. So let's just take hair analysis, for example. In 1995, researchers sent hair samples from 2 healthy teenagers to 13 labs that performed hair analysis. Reported mineral levels varied from lab to lab for identical samples, and even varied when identical samples were sent to the same laboratory and the samples were represented to be from different people. So they analyzed exactly the same sample different ways on different days. The definition of normal also varied between the labs. 6 of the labs recommended dietary supplements, and the types and amounts of supplements varied between even those labs. A 2001 study confirmed that absolutely nothing had changed. Researchers reported that hair mineral analysis from these laboratories was unreliable, and we recommend that healthcare practitioners refrain from using such analyses to assess individual nutrient status or suspected environmental exposures. Problems with the regulation and certification of these laboratories also should be addressed. That's what the researchers wrote. A 2011 analysis, 10 years later, showed that even when hair analysis is conducted correctly and appropriate reference ranges are used, which is not usually the case, correct diagnosis based on abnormal concentration of metals is not currently possible. Space limitations and time limitations really prevent me from providing similar analysis for all of the tests and the supplements and the protocols used by these functional medicine docs, but it just goes on to be more of the same. Bad tests that identify things that you don't really want to know about. Next week I'll deal with another one that I think is kind of important, but it's just the same thing. Now, I've had a lot of personal experience with many former patients of these doctors who become members of Wellness Forum Health. They all say the same thing. The doctor was so nice and spent so much time with me, but we can't confuse niceness with competency, and that happens all the time. None of these people benefited much from the extensive testing, expensive supplement regimes, and strange diets, often with very long lists of foods to be avoided based on an unproven method of allergy testing, which is why people ended up calling us. We had somebody come in the other day and spend time with our dietitian who had been placed on a diet by a functional medicine doctor who told her that she was allergic to everything but about 5 foods. The woman was down to 113 pounds at 5 feet 11 inches tall, and literally starving to death and wasting away based on what this idiot told her. And I don't usually use that kind of term, but I really don't know what else to call somebody who would do that to somebody. Per our instructions, many have asked that many of our members have gone back to their functional medicine doctors and said, look, you've told me that these tests that you did were valid, you've told me to take all these supplements, please give me the scientific studies validating the things that we're doing here. We haven't had a single person that's been able to extract this type of thing from a functional medicine doctor. Functional medicine, while claiming to be a better alternative to traditional medicine, actually is an awful lot like traditional medicine. Conventional docs recommend useless tests, many of which are designed to turn healthy people into sick patients. Functional medicine docs run batteries of mostly useless tests looking for conditions like heavy metal toxicity, adrenal fatigue, and food allergies, and due to confirmation bias, engage in just as much disease mongering as conventional doctors. They find what they're looking for. The use of supplements to treat symptoms is based on the same reductionist model of conventional medicine. Dietary supplements, like drugs, don't address underlying conditions, and they've never been proven to prevent, stop, or reverse disease. It could be argued that less harm results from what the functional medicine doctors do than conventional doctors, but the goal of treatment shouldn't be to hurt people less. It should be to improve long-term health outcomes more. Like conventional doctors, the functional medicine disciples seem to confuse feeling better with getting better. and they're just as focused on treating surrogate markers, only with supplements instead of drugs. At Wellness Forum Health, we don't refer people to functional medicine doctors, and we don't allow them to join our network. A few have inquired about taking our institute courses, but they become very disinterested when we start talking about learning how to treat depressed people through therapy without drugs or supplements, reversing coronary artery disease with diet alone, and using long-term outcomes-based evidence to guide decision-making. These strategies are just as bad for business for functional medicine doctors as they are for traditional doctors. So anyway, that's my story on functional medicine. Hopefully it'll help you to make informed decisions about whether or not you would choose to visit a doctor like this. As usual, press the subscribe button, make sure you're a subscriber, pass this on to anybody who you think would enjoy watching it, and I will be back to you next Tuesday with more news.